Thanks, Christy. Getting ready for this. We're joined now by SUNY Upstate University Hospital's head of infectious diseases, Dr. Stephen Thomas. Dr. Thomas, as always, thanks so much for joining us live tonight. Really appreciate it.
Hi, Jeff.
So we have quite a few questions to get to, so let's try to do them. People are worried. This is one we've got emailed to us. If they get the first dose, they're going to have trouble getting the second. Can you explain why people need to? And from what we understand, that will be scheduled for you. But to make sure they're not shopping around, that dose 1 and 2 are from the same company, right? You can't be mixing and matching Pfizer and Moderna. And system may not even let you mix and match like that, but I know people are trying.
Yeah, no, that's a very good point. You really do not want to mix and match. And the primary reason for that is because the studies that demonstrated that the vaccines are safe and effective are what we want to try to recapitulate when we actually administer vaccines. So 2 doses of Moderna, 28 days apart, 2 doses of Pfizer, 21 days apart. That's the schedule that we need to stick with.
If you don't get it exactly, because people will take you for your exact words or the words that we've heard a lot, if you don't do it exactly 21 or 28 days out, how big a concern is that? I mean, if it's a day off or so, probably if it's more than a week or two, that might be an issue, but what's the concern there, or isn't there any?
Well, again, we want to try to stick to the schedule that was proven to be effective in the clinical trials, and I just mentioned what those were. But, you know, the practicalities of life is sometimes people cannot strictly adhere to those schedules. So it is not really a concern in terms of safety. It can be a concern in terms of the type of immune response that you have after vaccination. And so it is much better to delay your second dose versus coming in early and getting a second dose, you know, a week or 2 weeks after that first dose. So if you have to go outside of the schedule, much better to delay than to go early.
Okay, and from what I understand, again, that you will have your second appointment scheduled when you do your first one, so that should take a lot of worry out of people's minds. Some people have their second dose already, especially that 1A group. Others have just the 1 dose right now. So how quickly does this take effect? When are you at maximum protection?
So maximum protection would be 2 weeks after you get your second dose of Moderna and 1 week after you get your second dose of Pfizer. So that's, again, those were the schedules on the study, you know, based on the studies. And so that's the information that we have right now. But both studies did show that even after a single dose, there is some level of protection, around 50% or greater, you know, just north of 50%. But what we really don't know is how long that single dose protection would work, which is why the FDA came online and basically said, yeah, we're not interested in doing what the UK is doing in terms of giving people a first dose and waiting a couple of months to give them a second dose. Yeah. Right, so that's why the FDA, and I agree with them, is saying we got to get these 2 doses into people as close to the schedule as possible.
Stick with what we know works so far. Even with that said, I don't want people to misinterpret when I said max protection. I mean, we still all need, whether you have your no dose, 1 dose, 2 dose, we all still need for probably at least the next several months to continue to follow our usual protocols, right? Masks, social distance, washing hands, things like that.
That's absolutely correct. So wearing a mask, washing your hands, and definitely stop the large gatherings, right? The gatherings should be your immediate family unit, the people that you live with, and a very small pot of people that you have chosen to spend the pandemic with. Because number one, the vaccines are not 100% effective. Very few are. Number 2, we don't know how long that protection lasts. These studies are 2 years in duration, so we could try to answer that question. You know, number 3, we don't know if these vaccines are going to prevent you from being infected or prevent you from transmitting it to other people. What we know is that 95% of people who get vaccinated don't have disease. They don't get sick. It doesn't mean they can't be infected, and it doesn't mean that they can't transmit to other people. So for those reasons, at least for the immediate future, we need to continue those public health interventions, even if we've been vaccinated.
Gotcha. Good advice, and we'll reiterate that a number of times probably in the weeks and months going forward here. I have time for one more here. I saw a Pfizer study that was released last week that shows the vaccine seems to be good against that UK strain that has now made its way into New York and I think at least a dozen plus places. Is that correct? Did I read that right?
That's correct. So we have a South African strain, we have a UK strain. A couple days ago, the Japanese have reported that they have a unique strain. So what these companies do is they take blood from people who have received their vaccine. Inside of that blood would be the antibodies that they created in response to vaccination. And then they take these new strains and they see if those antibodies can neutralize those strains. And so far, what the laboratories have told us is that, yes, in fact, these Pfizer-generated antibodies can neutralize these new strains that we've been hearing about. So fingers crossed that that will persist and that it'll actually play out biologically in people.
Great answers to a lot of questions we've been getting. Dr. Stephen Thomas, the head of infectious disease at SUNY Upstate Medical. Thanks so much for being with us. Appreciate it. We're out of time.